Well, I think this is an absolutely brilliant report. The number one reason that it really works is that it talks about the positives of longevity and then asks what are the things we can do to make the most of it, rather than seeing it as a problem that needs to be tackled.
It's my pleasure and privilege to welcome all of you.
I'm thrilled to see this lecture hall so full.
Longer life is not a problem to be tackled, but a goal to be pursued. And that is true for government too, as well as for individuals. It's true for the NHS, and it's true for each and every one of us.
This is not, a terrible thing, living longer. It's a great gift that we have, and we can actually. But our challenge now is to actually make sure that we spread it to everyone in society.
The health divergence between our richest and our poorest areas is significantly worse than other wealthy countries. So it isn't that this is just a fact of life. The data actually shows that we've got a greater span on healthy life expectancy inequality than other countries. So something is wrong there.
Our own estimate, which is in the report, is between 4.5 and 10.5 years of life are lost and known behavioural factors which we could do something about.
Bring together local businesses and the community organisations to work on the priorities in their area.
Adding just 1 year to everyone's working life could increase GDP by 1% per year, equivalent to more than £20 billion.
The reason I'm enthusiastic about this is the science of ageing has come on over the past 20 years to a point at which we now know the causes of a lot of those age-related diseases, shared common causes that we can actually tackle at source.
We want to live healthily for longer, and if we can achieve that, then we achieve huge things for the quality of life of millions of people, but also actually huge things for the Treasury.
On our calculations, it won't take 15 years to achieve 5 extra years of healthy life. It's going to take 75. The report does not underestimate the amount of work that there is to do.
We have a lot of support from the public, a lot of support from academia, from the business. I just need to think we need to tackle the government level.
We're in the third healthcare revolution. The first was public health, the second was high-tech in hospitals, and the third is driven by 3 forces: citizens, knowledge, and this.
The other thing that this report so well highlights is that if we're going to promote health, then it requires multiple disciplines and multiple kinds of intervention to be brought to bear within biomedicine, but outside biomedicine as well.
I think there's a common vision. There's a real sense of common direction.
I think the report is fascinating. It's well overdue. At last, we're really beginning to try and tackle the real determinants of old age and living well, living healthily.
In 9 short months, we have mobilised the most unbelievable array of organisations, experts, scientists, business leaders, third sector, NHS. It's just been quite incredible.
Well, success would look like a very powerful governmental white paper that spelt out why this mattered and that they were committed to doing most of the things that we think are fundamental.
I salute you for your work and look forward very much to working with you to make all this happen. Thank you very much.